I've been asked to give a bit of an overview around the current situation around COVID-19 and Peel Public Health's response to it. I wanted to start at the outset by really stating and highlighting a very important difference in context. The context that you are seeing often in the media in the United States with the progression of the COVID-19 disease is actually very different from the situation in Canada. And I would say, if anything, the U.S. is much further along in their COVID-19 outbreak. There are many reasons for why that is. But here in Peel and here in Canada, we are only really starting to see early stages of local transmission. We do know that local transmission has been established in Toronto, and we do know that there are cases here that are likely local transmission that we in Peel Public Health are currently investigating. This should not alarm or panic anybody. The reality about controlling an outbreak is that you actually have to determine when is the best place to implement social distancing measures. And what you want to do is ideally implement social distancing measures once the disease is established in your community, but before it has had time to cause significant health impacts. And so if anything, we in Peel and we in Canada are in what I would call a golden period in actually being able to flatten the curve and control this outbreak. The reality is that if you stop everything too early before the disease is in your community, you interrupt and really impact community life without necessarily stopping transmission because the disease is not there. If you stop things too late, then you start seeing pictures as we have in other jurisdictions around the world. So we are actually in a very interesting opportunity where, and Dr. Martino, I hope you can confirm this, but I know we've been in regular conversation, where we're not seeing the severity of the disease in our healthcare system just yet, although we know it will come as it spreads. But fortunately, we are also at this place where we can take measures to actually address it and slow its spread in our community. And so that essentially speaks to a lot of the recent declarations that have come forward. And I've been very thankful for folks in Brampton who have really adhered to the provincial orders that have really spoken to closing many different types of facilities, and specifically to bars and restaurants, knowing that this is very difficult for many of your workers, really focusing on providing takeout food and delivery. All of the measures that have been taken of late have been to really try to capture this golden period so that we can reduce the number of social interactions in our community and reduce the possibility that the disease might spread. So that essentially is a bit of an overview and a context, and really just to highlight that a lot of the concern and alarm, particularly around the American picture, the reality is that we in Canada are actually a little bit further behind them, and we actually have an opportunity to really, through effective social distancing, take control and actually try to slow this down. There have been other things that Peel Public Health has been doing in coordination and work with all of our partners to try to slow the spread of COVID-19 in our community. One of the most fundamental things that we have been doing is case and contact management. At this time, there are 25 cases of COVID-19 that have been identified through testing in Peel. And 9 of them are in Brampton. And with every single case, we have a team of public health nurses and epidemiologists who are out there determining where this person may have been and where they may have gone to ensure that any exposures and any people who may have contacted them are told to take appropriate precautions like self-isolation. And so that essentially has been the form and function of our response since we learned of this in the late part of 2019 emerging in China, and has really kept the disease at bay together with our healthcare partners throughout the midst of flu season for the better part of 2 months. So remember, like I said, we want to make sure that you have some transmission occurring in the community so that you can interrupt it through social distancing measures. So like I said, there are things that you can do to protect yourself and others from COVID-19. And I would encourage you all to think about these as we go forward. Really, the biggest one that I would speak to is gatherings. Gatherings are particularly challenging for public health, especially for case and contact management. Even 50 people, that means 50 potential contacts if someone at that gathering has a COVID-19, tests positive for COVID-19. So to the extent that residents can cancel and avoid large public gatherings and celebrations, weddings, times at banquet halls, all those other pieces, we really encourage you to maybe reschedule those or postpone those big milestones for maybe more ordinary times. We also encourage, and we're thinking about reducing gatherings, people to work from home as much as possible if your employment permits it. And certainly for you to spend maybe more time at home in general to essentially help to slow the spread. And if you do go out, we do encourage you to continue to avoid touching your eyes, mouth, and nose as much as possible. Wash your hands frequently and regularly with soap and water or using an alcohol-based hand sanitizer. And if you have been asked to self-monitor or self-isolate, to follow that advice and do stay home. And also particularly to stay home and self-isolate if you have recently returned from travel outside of Canada or have any symptoms that you may be experiencing. These are all measures that we can take during this golden period to slow the spread of the pandemic in our community. I wanted to also mention that Peel Public Health has been working diligently, both in terms of trying to communicate accurate and timely information through our call centers and also through people who have presented for testing. I do want to note that we are dealing with an unprecedented volume of calls and tests, and we do recognize that this is causing a lot of frustration for people in waiting for those. So I regret that deeply. We are in the process with our emergency response, trying to train up as many staff as we can to ensure that we are addressing these pressing needs in the community. We did want to highlight, though, that there are a number of resources that are available on the website for you to determine. And I did want to highlight a few things that you can think about if you're concerned about COVID-19 and where you might go. So the biggest advice that I can offer at this time is that if you do not have symptoms consistent with COVID-19, whether you have traveled or not, you do not need to necessarily be tested. So if you have no symptoms whatsoever, no testing is required. What we do ask is that if you have returned from abroad, that you do self-isolate for 14 days. If you haven't traveled, it's a matter of self-monitoring, just making sure that you're cognizant of whether you have symptoms and making sure that you're also limiting your time outside, which is helping to reduce spread. You can also use the online assessment tools that have been put forward by the province on their coronavirus website. And you can also check Peel Public Health's webpage on coronavirus at peelregion.ca/coronavirus for further information. I did want to close again by saying that we must act all together as a community in order to reduce the spread through social distancing. I also personally recognize that many of these recommendations can create challenges for families, for businesses. I myself am someone who enjoys a nice dinner out or a time out, but I do recognize that this is the moment where we need to act in order to reduce spread within our community and slow and flatten the curve. So we encourage residents certainly to take those precautionary measures to protect your health, follow the guidelines as you're able, and certainly you can follow us on Twitter at Region of Peel for further information on the coronavirus, or check out the website peelregion.ca/coronavirus. This is our moment to change the tide around the coronavirus, and I look forward to working with all of you on this. Thank you.